Feels good to walk, doesn't it, Kindred? Babe, can you come over here? Hi, Kindred. Hey, everyone. This is Amy and Carol with 100 Plus Abandoned Dogs of Everglades, Florida. We are here visiting with Kindred. Kindred received her second dose of chemotherapy. Come here, baby girl. Come on. She is receiving chemotherapy because she has TVT, which is a venereal disease. As you can see, it looks so painful. Hi, baby girl. We have to wear gloves right now for 3 days after the chemo. She received her chemo on Tuesday. Whenever she pees, I have to catch it with a pee-pee pad. Kindred was found in Miami on the streets, completely emaciated, every bone and rib showing, accented, her vagina completely bulging with infection. TVT is a venereal disease. She was probably tied, as you can see. Carol, can you show the tether mark? She has a tether mark around her entire neck. So either she was tied, used for breeding, because this dog has had, I don't know how many litters she was forced to have. She could have been absolutely tied somewhere. Again, used for breeding. This is her vagina. It was so infected with pus and blood. Now they have been basically washing and with all kinds of antibiotics.
There you can see it.
She was on fluids, IV fluids when she came in. She's been here at Lauderdale Veterinary Specialist 24/7. How long has she been here now? A couple weeks?
Something like that.
A couple weeks she's been here receiving 24-hour care with her private nurse. What are you doing? You listening to everything going on around you? She's such a sweet angel. This dog has nothing but so much love inside of her. So much love. You want to go inside on the blankie? Come on, baby girl. So Carol and I just took her out for a little walk. Little time to do some peepees. It's painful watching. It's painful looking at her. It breaks my heart. Hold on, I'm just going to throw this out. Now we're going inside. We have a room. There you go. Andrew picked a blankie with all kinds of stuff on it.
It's just
Strings. Go see Carol, Kindred.
Hi, baby.
Go see your friend. Hi, baby girl. Hi, sweetness. This baby is nothing but love.
Mommy.
You can see that when we first brought her in, if you think back, I literally could put my whole entire hand around her. She's still skinny, but all of her ribs were accented. Can't really see her ribs any longer. They're feeding her 3 times a day, or if not more. And she's nothing but love. Nothing but love. Hi, baby girl. Don't let her lick your face. Can't lick. Unfortunately, we can't let her lick our face. Hi, baby. Whoever did this to her and tied her and used her and abused her, I wish the same for you. This innocent, beautiful soul, what she has been through in her life. Can't even wrap my head around it. Can't. So as you can see, this is her back end. She's getting her head stroked by Carol. It's pretty graphic, but this is what we're dealing with. This is her vagina, so swollen. And the chemo is supposed to reduce all of that. She had her second dose of chemo. They said it was either going to be 2 or 3 doses. So she had her second. And before they give her the chemo, they do a complete CBC panel to check her blood, make sure she has no infection, make sure everything is where it needs to be. So they did that on Monday. And as you can see, she loves love. But I want you to take a look at these nipples and think, like I said before in my last video, how many puppies she was having on the streets. Where those puppies are right now, we will never know.
It's a baby.
It's a vicious cycle, guys. It's a
You
completely
can really see it right here.
What?
This, if you look over here.
Oh, the accent on her neck, yeah. I see it right here, Carol.
No, underneath.
It's completely around her whole neck.
Let me see.
Yeah. Horrible.
There's no more.
No mores. No more ever, ever, ever again. Never. She's nothing but love. She's definitely, yes, Colleen, she's more than okay. The doctors are hopeful for a complete recovery. Ah, there she goes. This is her favorite. She loves to lay down and she loves to get lovin' and belly rubs, and she's just so amazing. She's a small petite lab mix, maybe a little bit of a hound in her. Ah, that feels good. She's very, very, very expressive with her paws. Huh, Mama? Thank you. Thank you. Hi, Kindred. Hi, Boo. You're so beautiful. You love that belly rub, huh? So while she's on her neck, while she's on her back, and Carol's rubbing her, you can see her neck where she was tethered. You can see her nipples. I just can't. I can't wrap my head around this, what she's been through. But that's all behind her now. It's all behind you now, Kindred. Yes.
You like that?
Oh, sweet face. What are you doing? Are you swimming? You think you're swimming? You think? You think so? What? Can I have this part right here? Hi. Hi, Kenny. Hi, Kindred. Hi, sweet face. Hi, sweet baby. No kisses after chemo, unfortunately. We can't let her lick our face, our mouth. We're supposed to wear gloves, which we are wearing, and for 3 days after, because all the chemo is leaking. It comes out of her body when she urinates. And then if she's licking herself and licks us, it's just, yeah, definitely don't want that. So we're just here to love on her. Go get Carol. Get Carol. Carol's giving her a body massage. You're getting a body massage. You deserve it, Kindred. Yes, you do. Yes, you do. Are you smiling? Are you smiling, Mommy? She's probably about 4 to 5 years of age. She has a little bit of gray muzzle. It's okay.
What's up,
Yeah, you heard doggy steps? Did you hear doggy feet? Hi. You're fine, Mama. Good girl. Good girl. That's my good girl, Kindred. That's my good girl. Yes, my good girl, Mama. Go lay down with Carol. Go see Carol. They're lovins. They're lovins. Tails waggling nonstop. She will definitely be in need of a loving home or foster. I don't, just like we said with Murphy, thank God we had Lisa and Carol, because the last thing after a dog is in a kennel receiving, all this 24-hour care and medical treatment. The last thing we want to do when they're released from the 24-hour hospital is put them in another kennel environment. We want them to be in a home environment where they can get love and the attention that they've never received in their life before. So kennel environment for now, while she's going through her treatment, it's where she needs to be. It's the best place for her. Again, we're at Lauderdale Veterinary Specialists. And I don't know when they will release her. If she needs a 3rd dose of chemo, it would probably be after that, after the 3 days is up. So we're looking at probably, hopefully, if all goes well, within another maybe a week to 10 days, or a couple of weeks tops, where she will be needing a foster home. Now, she's not spayed, and we cannot spay her until she's healed, obviously. We have to find out what the long-term prognosis They said that she should not need surgery with the chemo. TVT is a venereal disease, and it is a form of cancer. But with the chemo, it is completely gone. It is cured. It's not your typical cancer. So we're hopeful and praying that she loves Carol. Praying that the chemo works, and then she won't need anything else, right? Other than fatten you up some more, huh? Just fatten you up. Why? What, Mama? I love those paws. I love that face. I love that face, Kindred. You're so beautiful, Mama. You're so loving. You're so forgiving. How is it? You ever ask yourself when you see all these animals and you know that the pain that they've endured and the abuse they've endured was because of humans, and it just blows my mind how unconditional and forgiving these animals truly are, to just accept touch and love. Why, Mama? You're such a good girl. Just rest. Enjoy it. Enjoy your massage. She's breathing a little heavy, like, this feels good. It feels so good, huh? Her neck, Chris, she was tethered, chained, rope, whatever they used.
She's got a line that goes over.
She has a very, very thick line. I would almost not be surprised if she had like an embedded collar at one time that healed. Whether she was cut loose and let to go and abandoned in the streets of Miami, or if she broke away and just wandered off after being tethered. Because that ring around her complete neck.
That's my phone.
Oh. That ring around her neck that is so deep, that ring did not happen overnight. And not only did it not happen overnight, but...
I don't know if it was a collar. It looks more like a rope.
Yeah, it's a rope or some sort of a tether. And something like that is on a dog for a long time to make that kind of a mark on them permanently. That's one of her unfortunate and very sad battle scars that we call them in rescue. These are battle scars. God bless you, Mama. God bless you. I'm upside down so I can get you. I'm upside down with the phone so I can get her beautiful face. Let me see the paws, Kindred. Let me see. Say hi. Say hi, Kindred. I bet you'd be a good swimmer, Kindred. With those paws, I bet you would. I bet. Hi. Hi, Kindred. Hi, baby girl. Hi, baby girl. Your tail's non-stop, Kindred. It just doesn't stop. It just never stop. Let's see. Let me see. Where are you? Where are you, Kindred? Where are you, Kindred? Hi. Hi, Mama. Hi, Mamas. Oh, she loves this. Look at her stretched out. Getting her little belly massage. Her feet are stretched. Her tail was going. And she's so pretty. Hi, Mommy. Hi, beautiful, beautiful baby girl.
You smiling?
She's saying hi to all of you. Guys, we have... I'm waiting for the teeth to come out and smile. That's what it feels like. We have her vet bills that are climbing daily of her stay here. We have a lot of vet bills to catch up on, so we are going to ask please to make a donation to our Kindred's Care for her ongoing stay here at Lauderdale Veterinary Specialists. We're still trying to catch up with Murphy, the puppy that we took in, $16,000. We still have not paid off his care here, so we have an outstanding balance, which means we can't take in another dog in need because we have to cover a vet bill. So we're asking please, if everybody could donate something, even if it's a couple of dollars towards their medical, so we can continue. And like I said, she's continuing to stay here, and every day it's a 24-hour. She doesn't leave here. This is where she's living right now. She should be here for another week, 10 days, 2 weeks tops, I'm hoping. But again, we don't have any place for her to go after this. As of right now, nobody has offered to foster. We don't know anything about her with other animals at this point. We haven't had a chance to test her. So if there's somebody out there that is home and, or just has no pets right now and could stand to have a beautiful girl like this in your home and just receive nothing but love and smiles from a grateful dog, it would be so rewarding and so helpful. Obviously, it would have to be somebody local while she's going through her ongoing. After her chemo, she's just going to have to regain strength and build up strength, and then we can eventually spay her. She doesn't have any babies, Kathy. She came into us with those nipples dangling and no puppies.
They found several small bones.
They found a lot of bones in her belly when they did an x-ray, and they thought possibly she could have eaten her babies. So that's unfortunate when puppies are forced to have litters and litters, or they're emaciated. They do this to survive in the wild. So maybe she knew they were sick. I don't know. But all I do know is that I'm so grateful that we were able to take her into our organization and, give her the chance at a life without pain, without suffering, without abuse, because what this dog has endured is just unimaginable. No animal should ever go through this, ever, ever.
Pretty girl. Are you? You pretty mommy.
It's pretty dark in here. I don't know why.
Huh?
Seems dark in here. I'm going to zoom in and get your little face. Where's your face? Where's that pretty girl? Where's that pretty girl? Hi, Kindred. Again, it's Kindred. I don't want to recap. So tired. But I don't want to recap and go through the whole. If you want to, when I shut this down, you can go back and, hi, Stacy. You can go back and you can listen to everything. It recaps, it tells you her entire story, her history that we know from the day that we rescued, what the doctors tell us, what she's endured, what she's gone through. Again, 4 to 5 years of age, TVT, venereal disease, severe, deep indentation of a tethering around her neck that is so deep and thick. So she was tied, tethered, for how long, who knows, used for breeding, no babies with her, nipples dangling, her vagina full of infection, now not infected, just trying to treat this to make the swelling. The chemo makes all this go down and go back to its normal size, but it is so big, so big. It's not oozing like it was before because they've been cleaning and washing and that's it. So I think I'm going to sign off, guys. I just wanted to give an update on our beautiful girl. You can go back and watch the video, and we're going to put the PayPal link with this video in hopes that you could please find it in your heart to donate for Kindred. We see that you love what we do. We see that you make all those beautiful comments of how it's amazing and wonderful and thank you and you're angels, and we so appreciate it. But those comments won't be there if we can't keep our promise and pay our vet bills to give these dogs the care that they need. This is not just, take a dog in and get it spayed or neutered and give it a vaccine and get it adopted. Obviously, you see the work that goes into this and the love and the time, the commitment that goes into these dogs. So, Desiree... Yes, it has. It has gone down some. It looks very swollen to me, but it has gone down some. Again, she's on her second round of the chemo. So I'm going to have some questions for the doctor. It's late. The doctor's not here. Dr. Blvd, I will call tomorrow and hopefully get some answers. So again, thank you for your support. And thank you for your love and your beautiful comments under Kindred. Kindred's counting on you. Right, Kindred? See, I need you. I need your help. Help me get out of here. I want to get better. I want a home. I want a family to love me. I don't ever want to be tied outside again. No more puppies. Was that a bug? You're trying to get the bug.
What was that? What was
She
that?
loves, she's so expressive. Look at how she holds Carol's hand. She holds your hand. She reels you in because she wants you to touch her. She will stare and gaze into your eyes for such a long time. She doesn't turn away. She makes total eye contact.
You want more? What's that, strength? You want more belly rubs?
And when you stop, she tells you she wants more.
You want more? You do. Come here.
There's our Kindred update, guys. This is Amy and Carol with Kindred. 100 plus abandoned dogs of Everglades, Florida. Thank you in advance for your prayers and your donations to help us allow Kindred to get the care medical that she needs here at Lauderdale Veterinary Specialists. Thank you.